Hello, this is week 5, lecture video 1. This is part 2 of the United States healthcare system. And this week, and this video, we're going to talk about acute care services. Acute care services, as we know, refers to immediate and short-term medical cares provided to people who have sudden or severe health conditions that need to be taken care of right away. They're usually delivered in a hospital, emergency room, intensive care units. There are urgent medical needs that need to be managed or long-term conditions that need to be managed, but because of acute care flare-ups. So these are conditions that need prompt, immediate intervention. Some key aspects of acute care services. One is timeliness. It's time sensitive. They need to be taken care of right away. They're not medical conditions that can wait a delay. They could stand a delay for treatment. They need to be taken care of, or they're going to have bad health care outcomes. Intensity of service. Acute care involves the provision of intensive medical services. This includes surgery, emergency department care, critical care, other specialized treatments, and just post-operative hospitalization, and hospitalization for medical problems that have some kind of acute flare-up, acute symptoms related to the chronic condition. It's generally of short duration. You keep the patient in acute care until they stabilize or until they can be transitioned to a different level of care, such as rehab or a post-acute care unit in a hospital or a long-term care facility. And there's a multidisciplinary approach. It involves the whole team of professionals, often different specialty physicians, surgeons, nurses, anesthesiologists, the whole gamut, the internal medicine. They're all working to stabilize the patient and meet their acute needs. Also, other members of the team, like the dietitian, the therapy services, are included if that is appropriate for whatever is happening with the patient. Significance in our healthcare system, emergency response. We staff our emergency rooms to be able to respond to emergency situations, of course, but we also have different level of trauma systems in the city, in the area, with some people, especially university, being known as a level 1 trauma center, where the most acute people are flown in for their care. Critical interventions, including ICUs in those acute care facilities. If a patient requires critical medical interventions, such as different levels of monitoring, especially in their respiratory or cardiac systems, that is provided. Surgical services, if somebody has something that needs immediate attention, or they have a acute, urgent medical surgical condition, that a surgical center would not be, a freestanding surgical center would not be appropriate. Like if they have comorbidities and they're having surgery, it would much more likely to be in an acute care setting in the hospital. And then life-saving treatments are provided in acute care when it's where those life-saving treatments are offered to save lives, of course, because life-saving. Significance, public health preparedness. Acute care facilities are a part of our public health preparedness in our communities. There are plans if there's a natural disaster or a large-scale emergency. The different hospital service hubs for managing the patient volume, and at least once a year you will see them having, even if it's not physically, they will on paper and through communications have a simulation of a traumatic event in our community. Different hospitals are where different conditions are taken so that the most patients can be served. Some hospitals, if people are ready for discharge, they'll discharge them, and stable patients that still need to be in the hospital from other hospitals will be moved so that the hospitals with the trauma background have room for the most number of critical patients. Integration with the continuum of care. Acute care is part of that broader continuum of care and connects with post-acute services, rehab, follow-up care, home care. The goal is for there be a smooth transition between services for patients as they move through different levels of treatment and have they're stabilizing. An economic impact. Acute care services contribute significantly to the healthcare economy. The hospitals and systems in our communities generate revenue through these services, and that helps support the overall healthcare infrastructure, including paying for our healthcare professionals who work in these systems. Components of acute care, I'm not going to read them here, but they are listed. These are all the different components that are considered as part of acute care. I'm not going to just read them to you, but know that when somebody is in acute care, these are the sorts of things that they access. And rehabilitation services there includes all of the therapies, physical, occupational, speech, and others. Which are acute care facilities? Hospitals, of course, have a wide array of services and treatments available. Emergency departments are usually in the hospitals, but there are some freestanding emergency departments, but they are open at all times, and they provide emergency care. Urgent care, they're outpatient to provide immediate care if it's non-life-threatening, and a lot of hospitals have their own urgent care, and the reason urgent care centers arose was because people were going to the emergency room for routine, even though they're acute problems, they're not emergent problems. So that's how urgent care services came into being. And then surgical centers, I mentioned these. There are ambulatory or outpatient surgical centers. If they're freestanding, they're still acute care, but they're not considered as for people that may have an emergent situation develop. Generally, instead of going to a physician community surgical center, they'll have surgical center ambulatory outpatient within the hospital, so that if somebody's condition declines, they can immediately be transferred to inpatient services. These are the trends that neither of the books covered this, so I've researched, and these are the things that I see as trends in acute care. And this affects policy because we need to know what we are and where we're going to see what policies need to be made to support healthcare excellence in our country. Trend one is evolving group of decision makers. Historically, it was the chief medical officer and chief nursing officers at the hospital. You might hear the VP of nursing or VP of patient services. They were the main decision makers in matters related to delivery of care. Now that in some places there will be a chief population health officer in the hospital and a chief information officer, they're playing an increasingly large role in decision making. The chief population health officer assesses metrics like chronic illness rates by area code, new trending diseases in the community, risk for readmission, to have data points to inform conversations with health insurers to ensure that the care that they think is going to be needed is going to get adequate coverage. And then the hospital chief information officer must balance how a hospital system can support all of the technology that is advancing inpatient care modalities while assessing costs, the strain and disruption of training employees on all these new technologies. If you work in a hospital, you know that when something new comes out, you all have to go to trainings. And the big thing is these days impact on system security, because some of these people that have been going in and breaching information systems have done so in hospitals and have held hospitals hostage and say, either pay us a bunch of money or we're going to wipe out your information systems. And also the risk of data breaches, where they are looking at classified information on patients. So what we're doing, medical technology companies need to be involved in offering technologies that will innovate care at the bedside to make it more efficient for caregivers and have patients have more positive health outcomes. Any way to streamline administration, operational tasks, charting, all of those things, anything to make that more efficient so that caregivers have more time to spend on direct patient care is very important. And then they also need to find flexible solutions to have hospitals meet the need for equipment, because the equipment can be so incredibly expensive and it is updating all the time. So you may have a new machine that in a year's time is outdated. So some of the companies, they have rental programs or something called long tail contracts for things like continuous renal replacement therapy machines. That helps a hospital because there's not a ton of patients that might need that, but it will allow the hospital to have the most up-to-date technology without perhaps having to directly purchase these machines, which are updated, especially the information technology piece of them is updated so frequently. Another trend is expanding care outside the hospital. In 2000, a recent study, I think it was from 2023, it said over 180 rural hospitals have closed since 2005. And 20 of those closures occurred in 2020 during the COVID pandemic alone. For those that remain, it's hard to staff, hard to have enough usage to validate having that care. So they might have to eliminate certain units, such as pediatrics and obstetric units, or reduce inpatient care. We see the example of that because we have such a huge Children's Hospital 40 years ago, other hospitals in the area had pediatric units, but the care was consolidated to children, and they no longer needed to staff pediatric units at other hospitals because we knew centralizing it was going to get the best standard of care. And you see it with OB units, a lot of the OB units in hospitals are closing because we have massive OB units at Christ and Good Sam. There's still a pretty big unit at UC, and of course Bethesda North, where you all go. The Mercy's had it at like multiple spaces, but I think they've contracted the number of their hospitals that they offer OB care at. And so that example is, it's not just rural hospitals. All hospitals are having to adapt to changes, and they need to find revenue streams, and increasing telehealth services is a big one, particularly when you have rural areas nearby, and increasing outpatient procedures at the ambulatory centers instead of having them stay overnight is cost effective if there are still good outcomes. They are also increasing the types of acute care that can be provided in the home, and they call it hospital at home care. And that is mostly possible because of advancements in remote monitoring. I mean, if you have a smartwatch, you can get it. They can watch your pulse, your blood pressure. They can do some rudimentary EKGs on there, at least enough to know when there is a need for more advanced care. Patients like it because that means they can get out of the hospital and recuperate more comfortably in their home. And that means that the hospital beds are only going to be for the sickest patients. And when I was in nursing school, and when I graduated nursing school, I was in school from 81 to 85, and 1981 to 85, of course. There were people, you stayed in the hospital forever. OB patients were there for at least a week. When my mother had open heart surgery in 1982, she was in the hospital for a month. Now, you have open heart surgery, you're out in 5 days, generally 5 to 7 days. So I like to say that when I look back over my career, the people that were in critical care back then would have been on a regular unit, and the people that are on the regular units, most of them they'd have been discharged, and the people that are in our current ICUs often would not be alive because we didn't have the level of care that we do now. So it's constantly evolving, and policies also need to evolve. You can read this slide. There is an increased focus on cybersecurity attacks. For some reason, hospitals and schools are amongst the biggest type of institutions that get attacked by people trying to take over systems so that they can hold them hostage via something called ransomware. It's a huge problem, and they don't go after big companies because big companies have a lot more money to spend to protect themselves. But technology has been evolving, and we are seeing, even though we're seeing more attempts at malicious activity, we're seeing less actual ransomware threats a recent article stated. People are actually not getting, even if they're trying, they're not getting to the point where they explode the system. There are companies that come in and just work within to fix the issues before too large a breach can happen, or the systems could be detonated and wiped out. Trend 4 is expanding virtualization and machine learning capabilities. ChatGPT was able to pass the U.S. medical licensing exam. It makes you wonder about the role of AI and augmented reality technologies in the hospital. I don't think ChatGPT will ever replace medical care or nursing care, but it can enhance it. When you think about it, something like AI, when, say, a person has skin cancer, if you take a picture of the lesion and there's some kind of AI that it can run through, that AI program can look at every picture of every skin lesion to determine if this one meets the standard of probably being cancerous or not cancerous. They can work very quickly. Now, it's not going to replace care, but it might be able to enhance our ability to provide care. There also is increasing augmented and virtual reality being used to help as a first and cost-effective first step. So, like, instead of sending a technician from the device manufacturer to service the device in a hospital-based technician who has skills can service the device through an augmented reality enabled troubleshooting guide instead of just a booklet. It's they put on goggles, the augmented reality goggles, where they can see as they're doing it what needs to be done. And we need lots of training, and you know that you're getting lots of in-service training when you're at the hospital. And they need to make that training more readily available and not having travel from the hospital. I know what happens. Either there'll be people that come and do the trainings from the companies, but not everyone in the hospital generally can make those, so we need to be able to have either champions in the hospital or ways to do that training virtually. Implications of acute care moving to the home for patients. They're going to be more comfortable. They're going to be feel more safe and happy in their own environment, but the home environments aren't always suitable for the necessary medical care and monitoring, so there are challenges there. There reduced infection, the risk of hospital-acquired infections may decrease because they're not in the hospital being exposed, but homes have their own infection risks, and that's challenging to maintain a sterile and controlled setting in the home. Quality of life, they probably will have a better quality of life when they're in their home, and the care will be will be more personalized and less institutionalized. But there also can be issues and challenges because there might not be the ability to have all of what is needed equipped in that home. And autonomy, they have more control, but they sometimes will feel overwhelmed by taking that extra control in their care. flexibility and work-life balance for nurses. This is implication for acute care moving to home for nurses. They may have greater flexibility in their scheduling and be able to have better work-life balance, but the challenge is the 24/7 nature of home-based care may have challenges in having a structured work schedule. The positive technology can enhance nursing practice, but that might have a constant need for training to be able to provide care in diverse settings. Nurses may have the opportunity to build stronger relationships with patients in the home setting, but they're not with the teams and with the team, and they're not having team care with other nurses there to bounce things off of, and other medical professionals there. So it's you can't really have the team collaboration as well in the home, and they may feel isolated. In resource allocation, it may reduce the strain on hospital resources, but it will require different resources that may be challenging, and it may be difficult to appropriately coordinate care across different settings. Now, these are the technology breaches for patients implications, privacy concerns, data exposure, your information getting out there, particularly your health information, is horrible, and the potential for identity theft also is huge. This may cause trust issues where patients no longer trust the healthcare system and are hesitant to share important but sensitive information. Impact on care quality. Disruptions delay treatment and can compromise care and can cause miscommunication among the healthcare providers, which affects coordination of care. Financial consequences, identity theft. They can have financial fraud because people get their personal information, and this may cause legal consequences where patients file a lawsuit for any damages resulting from a breach. Implication of technology breaches for nurses. Work disruption. The direct impact is if your technology fails and you can't do your care because you can't get the information you need, that of course will impact the way you can adequately deliver your patient care to have positive health outcomes. And you're additionally trying to help address security issues, so that increases your workload also. Indirect impact, we have, even without a breach, we all have increased workload now because we have additional security measures put in systems. But when a breach occurs, you have added security measures. You have to have retraining, and then the system's down, which can cause issues. Patient care challenges. The compromise of patient data affects our ability to have confidentiality, which can breach trust between the patient and their nurse. And being unable to communicate, especially during critical situations, information can cause a huge challenge to patient care. And then there's an emotional toll. When there's a breach, the nurses are worried about their patients. They have increased workload, and stress and burnout can occur after these breaches take place. The implications for hospital is they're going to lose money because there's going to be, they're going to have to investigate, they're going to have to mitigate the damage and recover from the breach, and there may be fines and legal penalties imposed if the breach violates data protection laws, that the hospital didn't have enough safeguards in place. A reputation damage, the community may lose trust in the hospital. can cause a competitive disadvantage because other hospitals will be able to say, we have not had this problem, come to us. Operational disruptions, downtime can affect your delivery of patient care. Resource allocation, you may have to move money, they may have to move money into addressing the breach, and that might impact other critical aspects of their system and their ability to deliver care. And then violations to regulatory compliance can have investigations and penalties applied. So as we're looking at health policies, this, knowing how the health system is organized is important. And I conclude acute care and will continue this week's lesson in video 2.